Good morning, ladies and gentlemen. My name is Philip Ichinglo. I'm the current DG of Taiwan CDC, and today it's my pleasure to talk to you a little bit about the One Health governance in Taiwan. We use the topic called towards One Health governance because we are still on the pathway of establishing a multilateral and very collaborated One Health governance in Taiwan, especially on AMR issues, antimicrobial resistance issue, but also including other aspects. So I think this audience is no stranger to the concept of One Health. One Health is the approach. It's more like a philosophy and a way to deal with public health challenges, but not only for human beings, but also for animal, plant, and also environmental health. So altogether, it brought back to some of the old ideas about that it's a planetary health system, so we need to work all together, not only for human health, but also for animal health, environmental health together. Of course, it's because the recent challenges encountering, especially in terms of infectious disease prevention and control, regarding all kinds of emerging infectious diseases, trace back to like Nipah, SARS, MERS, and Ebola, and most recently COVID-19. Many of these emerging infectious disease pathogens were originated from animal. But also we realize that the industrialization and also human activities, including travel, brought the animal world back to more and closer to the human world. So it's actually even in Africa or in Asia setting, we are more and more proximity to the wildlife, especially in terms of the threat of emerging infectious diseases. So that also highlights the urgency of bringing the One Health approach to the governance of infectious disease prevention and control, and also dealing with other public health challenges. The One Health, the more modern One Health concept can be traced back to 2004. The Wildlife Conservation Society's 2004 Manhattan Principles call for a coordinated global action to address health threats spanning humans, animals, and the ecosystem. The so-called One World, One Health concept was born, but it was pretty much taken by a very important and a key global stakeholders such as FAO and the World Health Organization, and also the Animal World Health Organization, WOH. So it's so-called One Health tripartite collaboration started their first strategic framework in 2008. And later on, the evolution of the tripartite collaboration bring the formal mechanism in 2010, and later on, the tripartite signed the MOU together with stronger focus on antimicrobial resistance in 2018. In 2022, another new stakeholder, UNEP, the environmental agency, joined and becomes the formal quadripartite. And they altogether established a One Health joint plan of action from 2022 to 2024. On this picture, you can see that they signed during the COVID-19 pandemic, so it's more like a telebriefing way. But still, the action plan highlights the importance of collaboration, not only from food, health, and the animal aspect, but also from the environmental health aspect as well. In that action plan, there were 6 action tracks highlighted. I used the red line to indicate the keywords. The action track 1 includes the health system strengthening, and the track 2 includes the emerging zoonotic epidemics and pandemics. For track 2 and track 3, they both look at zoonosis, but the track 2 more look at the endemic zoonotic diseases and also other neglected tropical and vector-borne diseases that could be controlled or even eliminated. For action track 4, it's focused on food safety risk. And for action track 5, it's antimicrobial resistance. And for action track 6, it's the environmental integration into One Health. And because this is an action plan, so the action needs to be taken and has to be taken step by step. In this action plan, they highlighted the different steps that can be taken. For example, situation analysis, and also set up a One Health governance and coordination mechanism, and also planning and an implementation of the plan, and then review, sharing, incorporation of lessons learned. And this year, I think the highlights of One Health approach was because in May, the WHA and also representing WHO officially endorsed One Health approach in this newly released pandemic agreement. So in the chapter 5, you can see the title is One Health approach for pandemic prevention, preparedness, and response. Of course, there are a lot of lessons learned taken from the COVID-19 pandemic response that we need to work all together in different sectors to, for the next pandemic prevention efforts. So now I will spend a little time of showing you the progress of One Health evolution and governance in Taiwan. Because of SARS, the Taiwan CDC has revised our communicable disease control law back in the 2000 years. So in that Article 6 already highlights a lot of these ministries that are responsible and collaborating in terms of infectious disease prevention and control. Here you can see in our law, the environment and agricultural authorities were already included by law. So the mandate for these authorities includes they are in charge of sanitation, disinfection of public environment, waste disposal, and for the agricultural authorities, it's responsible for zoonosis control and the control of fishing harbors. But so more or less, the mandate is a little bit limited to like certain degree of like response, especially in terms of dealing with the outbreaks. So another mechanism that is important is when public health emergency occurs, such as in COVID-19 pandemic, we have also the law in the Communicable Disease Act to launch a central epidemic command center. And in that command structure, the commander-in-chief is appointed by the Prime Minister and can have regional commanders of communicable disease control network working hand in hand in 6 different regions designated by Taiwan CDC. And also local health department and also county, city, like mayors and their health department and also city government, they establish their local epidemic command centers together. But in the central government, we also designate, for example, 10 functional groups for the COVID-19 response, integrating all relevant ministries and the government organizations together into different task forces, such as surveillance, border control, community control measures, and healthcare response. So in this command structure, of course, the Ministry of Agriculture, Ministry of Environment, they are included, but also we can integrate other ministries such as Transportation or Ministry of Interiors, and also the financing and legislative financial stakeholders all together as well. In terms of One Health, key One Health issues, for example, human and animal interface problems, I want to use several examples to indicate some of the stories happened in Taiwan decades ago. During the 2010s, the avian influenza became a real threat for us, especially during 2013 when the H7N9 influenza outbreak happened in mainland China and also had importation into Taiwan. So during that time, Ministry of Health and Agriculture worked all together. In the end, we were able to implement the decade-long call for the ban on poultry slaughtering in wet market in May 2013. So that's a very important tool in the animal authorities, but also beneficial for human health as well. Also, another important story is the wildlife rabies. That also happened in 2013 among the wildlife animal called feral badger. So Taiwan used to be a rabies-free country declared by the WHO. However, in 2013, 3 different spots in Taiwan simultaneously detect positive rabies among the feral badgers population. So during that time, health and agricultural authorities both worked together to launch a joint command center in order to control and respond to the wildlife rabies outbreak. So far, we haven't had any canine or cat circulation of the rabies virus in our more closely related animal population in Taiwan. So we were able to contain that rabies circulation only in the wildlife mammals. And also this is because of widespread vaccination campaign, especially on the dog population in Taiwan. So based on these very important examples between human health and animal health, both sectors decided to follow the international standards and conduct external review by outer experts. In 2016, Ministry of Health invited the international expert team to conduct the WHO's joint external evaluation, so-called JEE. Although we are not a member of the WHO, but we voluntarily wanted to pursue that evaluation. Also in 2019, the animal sector, the Ministry of Agriculture, they also follow the OIE's performance and voluntary veterinary services, so-called PVE, as an external review way of assessing the animal health response and preparedness efforts in Taiwan. Fortunately, because our Taiwan is an official member of the OIE, so actually they were able to work together with OIE to have an official evaluation team to come to Taiwan. But in both circumstances, not only Ministry of Health or Ministry of Agriculture, there's so many different ministries and agencies involved in this external review, so we were able to collaborate and work hand in hand to show the results and also tell the stories about how we collaborate in the One Health sector altogether for the external reviewers to see. A newer example of One Health approach comes to AMR. So in Taiwan, we are encountering an aging society, even a super aging society, and we know that the antibiotic consumption amount is increasing. But of course, during COVID-19, we see a slight decrease, but after COVID, we are now seeing research of the antibiotic consumption amount. That also correlates with increasing antimicrobial resistance rate in the hospital setting, but also in community setting as well. Previously, we were facing challenges of AMR governance. It's mostly the responsibility of the health sector, and there were also insufficient, unstable funding, and also lack of high-level commitment and stakeholder engagement. And there was no One Health mechanism established for AMR coordination as well. Fortunately, because of the higher political commitment in 2025, this year, we're able to launch a much bigger project, setting up the One Health AMR coordination mechanism, combining food, agricultural, and the Taiwan CDC together, and also the environment agency also came on board. So the multi-sectoral coordination and also the funding and Prime Minister commitment paved the successful way for moving forward this AMR agenda. So the target of the AMR National Action Plan project is that by 2029, we are ambitious to trying to achieve overall 5% reduction of the human sector's antibiotics consumption. And last year, during the announcement of this National AMR Action Plan, it actually attracts a lot of the media attention locally. And also we're able to show that the public interest in the government's commitment to AMR policies and also control measures. On the right-hand side, you'll see the organization chart of our One Health AMR mechanism, not only include Ministry of Health, Ministry of Agriculture, but also the Ministry of Environment is first time on board. Furthermore, the Prime Minister's announcement this year in having a much bigger One Health approach correlates with the idea of the joint action plan announced by the quadripartite. So for Taiwan, it's the first time that the Prime Minister's office established a national One Health task force. Together with we are preparing to launch a joint action plan starting from next year. There are also workshops and press briefing to address the One Health national policy this year. The workshop happened in March, that we were able to pull together all the ministries' representatives together and showing the pathway and the steps that can be followed to achieve the One Health goal. And jointly, we are brainstorming about what kind of work plan we can put into the action plan together. This is just a task force established also earlier this year. The chairperson is Dr. Chen Shizhong, appointed by the Prime Minister. And also we are separating following the international action plan that there are 5 action tracks looking at zoonosis and endemic diseases and food safety, AMR, and also environmental health together. Again, this shows the 6 action tracks that can be found in our National One Health Joint Action Plan proposed at this time. We are hoping that the pledge budget will be passed by the Legislative Yuan, and we'll be able to implement that from next year on. Some of the highlighted work that will be conducted next year is on the left-hand side, you see we're able to conduct another JEE using the latest WHO's tool next year. And also the animal sector and health sector will work together to put out the innovative collaborative surveillance and strengthen our multi-sectoral response and R&D and the industry response as well. And vector survey, risk communication, and here there's a new entity called the plant doctor. That is a very important workforce area for developing. And also AMR lab workforce development, IPC workforce development, and also another areas such as the biodiversity ecosystem preservation as well. So I think recently we also have some news. For example, the recent outbreak of African swine fever in a farm in the central Taiwan area. Unfortunately, it was quickly controlled by the multi-sectoral collaboration mechanism, and we haven't seen any spread of this African swine fever as well. On the right-hand side, you'll see this is still an ongoing event, the eggs contaminated with pesticide entering our market. So I think all these 2 events shows the importance of combining the One Health efforts in place, and we hope the new One Health mechanism, task force, and multi-collaboration will help to strengthen the preparedness and dealing with the public health challenges in Taiwan better. Thank you very much.